everybody. We're pleased to see everybody here, and we will go ahead and get our first program of the year started. My first observation is the lunch must have been very good because I am wearing part of it, which I only do when it's really good. So that's a good sign for a good meal. So it's great to see everybody. Our program today, I think, is not only appropriate, but a good way to kick off our speaker series. Before I do introduce our speaker today, I want to remind you, if you haven't had a chance to look already, we've outlined for you on your tables the speaker series. I think you can see we've got a good lineup of topics and speakers. So please continue to come and encourage your friends to come. I know that starting in October probably put us off on the wrong foot a little bit with a few people scheduled, but we're back on track. So we've got some great programs lined up, and I think you'll find them enjoyable. So before we talk about today's program, I also want to just note, I'm sure everybody here already knew this, but we did lose one of our participants this past summer, Bill Overstreet, passing away, and he made just about every program, and George may have been the first one to ask questions, but Bill was usually the second. So we miss him. He's a great guy, a good college supporter, but he was always here with his wife Gwen, and we were sorry that he passed on, but he left a great legacy, and so just want to take a moment and acknowledge that because he was a great participant here. But on a little bit happier note, let's talk about today's program and get to our speaker. Our speaker today is Stephanie Paul. She has a lot of things to her credit. Of course, the one we noted right away is she's a Jefferson College graduate. That's really the most important thing. Everything else is, secondary to that. She is currently the Information and Assistance Specialist for the Mid-East Area Agency on Aging. Could you make that more difficult to say?
It wasn't my doing.
Mid-East Area Agency on Aging. Okay. The acronym's no good either because it's MEAAA, so it's like MIA. I don't know if that helps or not. Here in Jefferson County, she is responsible for providing education on community resources as well as case management services to the caregivers and certainly older adults in Jefferson County. She's been working with older adults and their families for over 5 years, and she currently volunteers as an Alzheimer's Association caregiver support group facilitator. She's a graduate of Windsor High School, Jefferson College, and University of Missouri St. Louis, where she got her bachelor's and master's degree in social work. She also has a certificate in gerontology from the University of Missouri St. Louis and is a certified information and referral specialist in aging. She's currently working to become a licensed clinical social worker, and today she's going to talk to us about the programs and resources available through the MEAAA for older adults and their caregivers in Jefferson County. So would you please help me welcome Stephanie Paul.
Clicker here. Good afternoon, everyone. Like you said, my name is Stephanie Paul, and I am the case manager and information and assistance specialist for all of Jefferson County. So today I just wanted to briefly go over what Mid-East does and highlight some of our programs and some of the other things that we are kind of connected to within the community. So first of all, who has heard of Mid-East Area Agency on Aging? Oh, good. Okay, of those who haven't, who's heard of the senior centers? You know about senior centers and Meals on Wheels, right? Okay, that's actually the biggest program that we have, and I'll talk about that a little bit in a minute, but a lot of people just don't know that we're out there, so I'm glad that I've had the opportunity to come here today to let you know a little bit about us and raise some awareness in the community about what we do. First of all, our mission is to assist adults through the journey of aging. It's very, very broad. That means a lot of different things. But we are one of 10 area agencies on aging in Missouri, and there is an area agency on aging, or AAA, in every county, every city across the United States. So no matter where you live, there is a AAA that does provide some similar services to what we do provide, one of those being Meals on Wheels. But Mid-East, I'm just going to shorten that to Mid-East from now on. We do provide services in Jefferson, Franklin, St. Charles, and St. Louis County. Okay, St. Louis City does have their own AAA, that's St. Louis Area Agency on Aging. And we have been around since 1973, so I was not responsible for our name. And all of our funding, most of our funding comes from the Older Americans Act, and also through the Department of Health and Senior Services, and we do rely heavily on individual contributions, corporate sponsors, you name it, because we, just like every other nonprofit right now, are really struggling with funding cuts and things like that. So just wanted to mention that. We do have 26 senior centers throughout our 4-county region. Here in Jefferson County, we have 4. That would be the Quad Cities Senior Center in Crystal City, the DeSoto Senior Center at the KC Hall in DeSoto, the Arnold Senior Center at the Arnold Recreation Center, and the High Ridge Senior Center at the Parks and Recreation Building in High Ridge. So those are the 4 that cover the county here in Jefferson County. At those centers, we do have a lot of activities for seniors to come in and actually socialize, play games. We have exercise equipment at a lot of them. We even have the Wii, you know, you can do some bowling and golf or whatever at some of the centers. We do health screenings, all kinds of different things. We do flu shots, you name it, you know, there's a lot of different things that we do there. But the most important thing is providing nutrition for seniors. And so we do provide, you know, we call them congregate meals, where folks come together and around noon we have a meal. There is no charge to come to the senior center, but we do ask for a $3.25 contribution just to help us, you know, support the program. But if anyone at any time is not able to contribute that, they will not be turned away. So, and that contribution is also accepted for the home delivered meals. So we rely on volunteers and a couple of paid staff to go out and actually deliver meals daily, hot meals, to homebound seniors that would not receive that nutrition otherwise, and maybe wouldn't even receive any kind of socialization. They might be homebound and not have anyone visiting them except for that person that delivers their meal every day. So it's a very important service to keep people in their homes for as long as possible. We also do have transportation available to the senior centers for folks that, you know, might not be driving any longer, or you know, that is a really, really hard issue. You know, a lot of people as they age, you know, realize it might be time to start giving up the keys, but they don't want to give up their independence. So this is one way that we're trying to allow them to still get out in the community, still be a participant at the center, and make sure that they're doing that in a safe way. So again, a suggested donation of $3 round trip for transportation to the center. And again, not required, but just a suggestion. On the same conversation of transportation, not only do we offer the ride to the senior center, but we do also provide transportation for medical appointments and for local essential shopping trips for seniors. So anyone who has to go to a doctor's appointment within Jefferson County or would like to go to their local grocery store, we do have a schedule set up with Oats, and they would just contact Oats a few days or a week prior to their appointment or wanting to go shopping, and they will put them on the schedule. Again, a small suggested donation, $6 or $6.20 or $6.50, depending on whether it's medical or shopping. Okay, the other, and I mean, I wanted to let you guys know, if you do have any questions as I'm going over this, because I know there's a lot, and I know I talk fast, so feel free to raise your hand if you have any questions, or stop me if I need to clarify. Yes, ma'am.
On transportation.
Mm-hmm.
Yeah, I heard there was transportation to the hospitals or to the doctor's office, or to, if, you know, like if you had somebody drop you off when your kids, but you needed to ride back home. Is that under Oats, or is that under
At the hospital?
Yeah,
I
or
mean,
is that under a different?
Each of the hospitals actually have their own transportation programs.
Okay,
Like
so-
Jefferson Regional has their own transportation program for,
St.
say,
John's.
I'm not sure that's out of I'm Jefferson County, so I know about a lot of the local resources like that. But you would want to check with the hospital that you're going to and see what their senior transportation program
Yeah, I
is.
just found out about that.
Yeah, because I know St. Anthony's has something similar, and St. Clair, the new hospital in Fenton, also does have something similar. But they do all have their own restrictions. It
You
might be.
contact them.
Yeah, so you would want to contact your local hospital and ask about transportation options. But this, yes, you can use this to get to the hospital if their transportation program does not offer it to the physician. For instance, Jefferson Regional does provide transportation, but only for medical services, not for the physician's offices. Okay, so if you're going to just see your doctor and not like a test or a specific service, then you can use the OATS transportation for that. Okay, is that clear to everyone? Okay, go ahead.
I'm under the impression, and I hope I'm mistaken in this, but I'm under the impression that OATS and these other transportation services don't really service Hillsborough. Am I right or wrong about that?
We do provide service to Hillsborough, yes,
I see
or
there's
OATS
buses go
does,
through, but
yes.
And I don't know what in my past makes me think
Yes.
that.
It may be limited depending on where in Hillsborough that person lives. If it's very, very rural, it may not be within the boundaries of the bus route, but the person would want to call OATS and find out what their coverage area is for that particular day. And that's the other thing, is that they do have a schedule. So there's certain days of the week that it may not be available for that area. So because they kind of all trade a little bit, so it's available about 4 days a week in each area.
How far does Oaks go? It's like, I had something done, but I had something done on Highway 40 and Mason Road.
Yeah.
And, it was a hassle trying to get my kids all coordinated.
Sure.
And it would've been easier just to have them drop me off and maybe had
Mhm.
the bus or something just pick me up and I wouldn't have had to,
Right.
or
The-
the other way around.
Right. As far as the OATS daily transportation, it does have to be locally within Jefferson County. Okay.
Yeah.
But 1 day per month, we do go to St. Louis County for each area,
Oh.
for each quadrant of the county. So you would want to call OATS again, and
So
their
once
numbers.
a month you do?
Once a month, we do have pre-scheduled trips to St. Louis County, but you would just want to call OATS and find out what day that is so that you can try to coordinate your doctor's appointments for that same day. Okay? And if you guys have any more specific questions about the transportation, feel free to give me a call, and if I don't know the answer, I will find out. I will call OATS for you and get the scoop. Okay? All right. Next, the other big program that we have is the National Family Caregiver Program. So this is for anyone who is caring for a loved one that lives in their home that is over at least 60 years old, 60 years or older. The caregiver themselves does not have to be over 60, but the person they're caring for does. Some of the things that we do for the Family Caregiver Program are in-home respite. So that would be basically we pay for an aide to come out to relieve the caregiver for a few hours so that they can get out and go to their own doctor's appointments, be able to visit with their friends. Sometimes they just go and take a nap. It's just whatever they need to do to relieve some stress and get some help. So that is a really, really valuable service. The other option would be adult daycare. So if the person is mobile enough to leave the home and would like that socialization, then the caregiver can take them to an adult daycare 1 day a week, and we would help with, financially pay for that service as well. Adaptive equipment, so if there's anything that's not covered by insurance or Medicare, like bath chairs, grab bars, let's see, what else have we gotten before? Extra walkers or transport chairs, like the lighter, Medicare will pay for a wheelchair, but they won't pay for the transport chair, which is more easily taken to grocery stores or doctor's appointments and things like that, and you can store it in your trunk a lot better. So things like that, things that aren't covered under Medicare that the person just wouldn't be able to get otherwise. We also have home modification. The biggest home modification that we do is ramps. We do have a limit of $500 that we can put towards a ramp, but a lot of times we'll work with other agencies or with, a church group or someone. If someone is willing to build a ramp for someone, a lot of times we can get the materials for about $500 to do that. So that is another really, really valuable service. We also have the caregiver supply bank. That's very broad. The supply bank basically is some financial assistance to help pay for some really expensive items. Those items being incontinence products like Depends, Poise, and also nutritional supplements, Ensure, Boost, Glucerna. Those things are really, really expensive, but they're vital to making sure someone doesn't have wounds, make sure they're clean, comfortable, and then also the nutrition, making sure that they're healthy. They might need that extra nutrition to keep their weight on if they're no longer active. So again, things to keep that person at home as long as possible. And then case management. So if that person or that family is needing some extra guidance in between visits or in between the respite visits and things, they can call me and I will provide them with a little extra guidance and connect them with resources. So again, for the single individuals, so those were all caregiver services. These are now services that are available for anyone who is 60 and over, okay? The first one being, again, the supply bank for senior independence. So we can also provide incontinence items and Ensure nutritional items for single individuals that are 60 and over. In the spring, we do tax counseling for the elderly. So we do simple tax returns and the property tax credit. Is anyone familiar with the property tax credit? Does anyone know about the circuit breaker? Hear about the circuit breaker? Okay. That is actually a program that is available for anyone who's over 65 or 100% disabled that is under a certain income so that they can receive a little bit back on their real estate taxes or their rent paid if they pay rent. So the income guidelines for that, yes,
Comment, the homestead exemption is not available
Right.
this year.
yes. There was previously a homestead preservation credit also that did give a little bit back on real estate taxes for folks that had a little bit of a higher income, but that was not renewed for this year. So it is no longer a program. But the property tax credit was renewed, which is very good because a lot of people rely on this money heavily.
Is this information available in?
Yes, a lot of this information is available actually in the book that I passed out to all of you, the Active Aging Guide, the little one. Yes, and if there is anything specific that you would like more information on, feel free to call me, and there is a lot of information here on the table. So, my number, I have it on my business card, it's also in that book, and I will have it at the end as well. So, property tax credit, the income guidelines for homeowners is $30,000 for a single individual and $34,000 for a married couple. So if you own your home and you have an income under $34,000 if you're married or $30,000 if you're single, you can get this credit. The income for renters would need to be under $27,500 for a single person and $29,500 for a married couple. Yes.
Is there income limitation on some of the other services, specifically
No.
supply bank?
The property tax credit is actually through the Department of Revenue. It is just a program that we help folks apply for. All of the services through Mideast directly, the supply bank, the family caregiver programs, the Meals on Wheels, none of those are income based. So none of our programs are income based unless I have income guidelines up here, because those are programs that are not administered by us, but that we help people apply for. Okay. So again, you can, if as a renter, you can get back as much as $750 a year, and as an owner, you can get back as much as $1,100, and you can go back up to 3 years. So if you've never done it before, you can actually go back all the way to 2007 and get a credit for each year. Yes.
Is this just for Jefferson County?
No, this is for all of the state of Missouri. The property tax credit is for all of the state of Missouri. Yep. Yep. Okay. Another thing that we do a lot of outreach for is Medicare Part D. I know I'm going over a lot of things, so I'm going very briefly over a lot of things, but if you guys have more detailed questions, feel free to let me know, and I will be happy to talk with you individually. But Medicare Part D, another really, really big thing. Every year, Medicare Part D plans change. The premiums go up, sometimes the formularies change as far as what drugs are covered under that plan. So what we do is we do a lot of education and outreach for folks to let them know what they should expect for the next year and help them shop around and make sure that they are in the most affordable plan based on the medications that they're taking and based on what their needs are. So that is actually what this form is for. We distribute this form at all the senior centers, to all the folks that receive Meals on Wheels. I bring this with me to all presentations that I give, and all you have to do is fill this out and send it back to me. My address is on the back. And what we'll do is I will go in and actually do that research for you. I will do all the legwork, find you comparison of this plan would cost this much versus the plan that you have now costs this much. And you can compare it side by side and make sure that you're in the most affordable thing for you. Okay, so anyone who has prescription coverage through a Medicare plan, I encourage you to, do this with me or go to medicare.gov if you're computer savvy and do that comparison. It's really, really important because so many times people, January 1st, they go to get their medications refilled and they find out that one of their medications is no longer covered under their insurance and they have to pay the full price. The full price on some of these medications is hundreds of dollars a month. So it's really, really important that you educate yourself and make sure that you're in the best thing for you. So, off of my soapbox. And then also along with that, we do a lot of prescription assistance programs. So we help people find out if they qualify for any extra help with paying for their prescription costs. There's a program through the state of Missouri called Missouri RX. This one, if you have a Medicare drug plan, even if you have an HMO like Essence or Medicare Advantra or any of those, I don't know if anyone's familiar with any of those terms, but if you have drug coverage through Medicare in any way, then the Missouri RX program would be able to help you with 50% of your copays on your drug coverage, on your drugs when you get them filled. If when you're married, your income is less than $29,140, and if you're single, your income is less than $21,660. So if that is you, if you do meet those criteria, let me know. I can actually fill out an application for you over the phone, or I can send you an application, I can meet with you, because that can be a tremendous savings. I mean, go to the pharmacy and only have to pay half. Pretty good, huh? Also, there's a low income subsidy through Social Security, and that one does have a smaller income threshold. Your income would have to be less than $16,245. I don't know where they come up with these numbers, but $16,245 for a single person, or $21,855 for a married couple. And your assets would have to be less than $12,510 for a single individual, and there's a lot of numbers, and $25,010 for a married couple. That is all in this brochure. Chubby Checker. Okay, so grab a Chubby Checker on your way out if you think you might qualify for that. That one covers a lot of the premium cost for your drug plans. It covers almost all of the copay except for maybe $2, $5, something like that. And you wouldn't have a deductible at the beginning of the year if you qualify for the full help. Yeah.
Is that just for Jefferson County,
No,
Missouri?
this is nationwide.
Okay, it's
This one is nationwide.
Thank you.
Missouri RX is all of the state of Missouri. Okay, so the Social Security program, the low income subsidy, Chubby Checker, that one's nationwide. But Missouri RX is all of the state of Missouri. Okay. And then also we can check and see if there's other programs. So even if you don't meet those income guidelines, or if you don't have a Medicare drug plan, we can still do some research for you and see if there's other programs out there. A lot of drug companies have, programs that you can get free medications or low-cost medications. So we'll link you up with whatever we can. Okay, so some of the other things that we do, there's a program called Benefits Outreach. Again, this is a nationwide thing. It's available, you can do it online, or you can contact us. It's benefitcheckup.org. And it basically allows us to put in some information about you and about your income and where you live, and it will print up every single social service program that you are eligible for, from food stamps to extra help with prescriptions, to help with energy, to help with, whatever. So it's really, really valuable. It's a really great program, and it's very comprehensive. So we do a lot of that, and just checking to see if there's any way we can help someone financially. Because right now, we all need a few extra dollars in our pockets. So also, we partner with the United Way this time of year to put on the 100 Neediest program. Is anyone familiar with the 100 Neediest program? You remember, seeing in the St. Louis Post-Dispatch around Christmas, they start, or from Thanksgiving to Christmas, they actually print 100 cases for the St. Louis area of folks that are in need, and there's some really, really heart-wrenching stories out there. But we are one of the partners, so we do submit names and stories for that. Usually every year we have at least one of ours that ends up being published. So it's a great way to help out a little bit more at Christmas time. We also do Christmas Day meals. So we have volunteers that come on Christmas Day and go out and deliver home-delivered meals to folks that don't have anywhere to go or are going to be alone on Christmas. We also give them a little goodie bag with some gifts and some extra things. And it's a really, really great service, especially Christmas. You don't want to be alone, so it's really great to be able to offer that and put a smile on somebody's face. We're always looking for volunteers for that as well. We also have a silver-haired legislator. So it's a group of seniors that advocate for seniors in Missouri. They go to Jeff City, they meet with representatives, and they advocate for your rights and benefits for you. So volunteer opportunities. So we always will find a way, if you are willing to help us, whether it's by calling a senior that is homebound, or delivering a meal, or helping file paperwork at the senior center, or whatever it is that you can do or you would be comfortable doing. We're always looking for extra help, and it's a really great way to meet people that are like-minded, very generous, and put us, again, be a part of something great. We also have a resource database. So this is online again, so if anyone is computer savvy, the website is moaging.com. Yeah, I always forget if it's org or com. moaging.com. And our agency, along with the other 9 AAAs throughout Missouri, we all put in resources. So whether it's a church who provides financial assistance, or it's the college who offers education, or it's the hospital who has transportation, we collect all those resources and put them into this computer database so that those are available to the community to look up anytime. And it's also helpful for us because when we get a call about what transportation is available for the hospital, we can go in and narrow that search down and find out what resources are there for you. So it's another big part of what we do. This slide, information assistance, what does that mean? That's what I am. I basically provide information on just about anything someone has a question on. If someone is asking about any resource that is available for a senior citizen or for a caregiver, they are welcome to ask me that question. I have heard just about everything. And then I get surprised time after time of what questions that I can be asked. So there really are no stupid questions. So I get asked things about, of course, transportation, housing resources, where are the subsidized housing options for their low-income housing options for seniors? What about long-term care? What are the nursing homes and how much do they cost? I have that information. Information on Medicare and Medicaid. How do I qualify? How do I apply? Give me a call. I can help you out. Again, what other volunteer opportunities there are, not just with our agency, but community-wide. How can I get involved? And so much more. I mean, you name it, I can help with it. Or I will find someone who does. I will find someone who does help with that. So I went over so much information, and I feel like I went over it very quickly. Does anyone have any questions about what Mideast Area Agency on Aging does? Yes, ma'am.
I haven't heard about this program, Grandparents Raising Grandchildren.
Yes.
Can you tell me about that?
We are a part of the grandparent network, I guess is what it's called, Grandparent Kinship Network. It is basically a bunch of different agencies that do provide social services for grandparents or relatives who are raising their grandkids. We are not the main contact for that network. That would actually be the University of Missouri Extension. They're the ones who are the main group for that. We're not very active in Jefferson County. We're more active in St. Louis County right now. But I'm very interested in expanding and being able to provide some things down here. We do have some caregiver support groups for grandparents and other kin that are raising grandchildren or relatives. They also can sometimes provide emergency financial assistance to grandparents that are unexpectedly having to raise grandchildren. And basically just a lot of support, other grandparents to talk to, and again, linking people up with community resources. Because a lot of grandparents, they're raising their grandchildren and they think that they need the help for that grandchild. But really, there's a lot of things that we can do for that grandparent to help financially. Again, if we can link them up with services to help them, the overall picture will improve. So, yeah. Is there any, yes, ma'am.
Do you have any list of geriatric doctors?
I have a list that the Alzheimer's Association has created of geriatric physicians and internists. I don't like to recreate the wheel, and I know they have great resources, so I rely on them a lot for community resources. But yeah, you can definitely give me a shout, and I will be happy to mail you some information.
Okay.
Yes, ma'am.
Have you made the services available to all the churches in Jefferson County?
I have gone out to speak with a couple of churches.
You don't have literature that you can, because I know that there is a group of nurses
Mhm.
that service churches, but
The parish nurses?
the parish
Yep.
nurses, but the fee is rather high.
Okay.
And you're providing services that they provide
Mhm.
to communicants of various churches. And I
Right.
wonder if the churches knew what services
Yeah.
you can offer,
And
whether it would help
right,
them.
right. And that's where we need people to help us spread the word about what we do and who we are. I have gone out and spoken with a couple of churches that have invited me, and I've provided that education and provided that information to them. And I have also in the past sent out flyers to various churches, but again, there's so many in the county that it's hard to catch all of them.
I think what
But-
I'm asking you is, do you have a general piece of literature
Mhm.
that isn't terribly heavy or large, that could be mailed out to all the churches, to the church secretary, so they could make it available?
Right.
And then they could call you if they want
Right.
more information.
We do have a smaller, just one-page trifold brochure as well. I didn't bring that because it is a duplication of everything that's in the thicker brochure that I brought. But yeah, that's something that if a church is interested, I would be happy to mail them information about that. It's just I would need to find out what churches I
In
can
other
send
words,
that
they
information
have
to.
to go to you.
Well,
There's
yeah,
nothing
because
automatic where you could go to
right,
them.
because it would be a large effort for me. I'm the only case manager in Jefferson County. It would be a large effort for me to try to compile a list of all those churches and mail all that out. And it's kind of expensive also. And we're really needing to, squeeze our belts tight and try to, gather our resources. So, but yeah, if you know of any church, if you are a part of a church that I've not come out and spoken with, let those folks know, and I'll be happy to let them know about us. Yes.
One thought along that line, you're using email,
Mhm.
if you could contact, say, a conference office, or we belong to the Methodist Church,
Mhm.
the conference office, they could possibly give you the email
Yes.
address of all the
Yes.
Methodist churches,
Yes.
or Lutheran, or what have you.
Yeah.
And send them an email.
That would be great.
But then, you could do maybe a half or a dozen phone calls
Sure.
and get 1,000 addresses.
Sure. Yeah. I hadn't thought about going that route, but yeah, that is definitely, email is the best.
It's inexpensive. and
Email
it
is
does exactly
free,
what you're
and
saying.
you can reach thousands of people with one click. So yeah, that is I communicate a lot by email. I'm a part of a lot of email groups, education groups, and information sharing groups. So I would be happy to
Take a look at that.
try to find another way. And there is a ministerial alliance group
Yeah.
in Jefferson County that I just recently heard about, and I'm definitely looking into partnering with them. So that would be another way. Yes.
Do you know who it would be for St. Louis County?
St. Louis County would be our central office, which is, it should be on the brochure, but it's 636-207-0847
Yeah, it's on the map.
or 1-800-243-6060. Okay? Yeah, it should be on all of the brochure. The main number is on all of the materials that we have. But my number directly for Jefferson County is this here.
To call them to find out about the transportation to.
You can start there. Or in that book, there is also there should be the number for Oaks in there as well. But you can call. You can definitely always start with us directly, and we will get you in contact with where you need to go. Yes, but you can still call that number, and they will give you the number for Oaks. Or you can call me. 636-933-1347. So again, 636-933-1347. So I will be happy to take calls and answer questions and link you up with resources or get you involved in one of our programs if you are interested.